Hi, come on in, take a seat. Just finishing up some files here about a client. How's your day so far? Good? Awesome. Okay, remind me your name. Okay, got it. Welcome. Let me just pull up your file here. So I understand this is your first time here at our clinic, correct? Okay, great. Welcome. I feel like I've said welcome so many times. Just want to make sure you really get the special treatment here. Okay, so this is your first time. That's fantastic. Where are you transferring from? That's a great hospital. Yeah, great. Okay, so this is just a yearly exam for you. We just want to make sure everything is up to speed. I also feel as your new main doctor, by the way, hi, I'm Dr. Jazzy. I just want to make sure that we have a good base understanding of who you are, any medical history, and just checking up on your overall health, okay? All right, perfect. All right, so I've got you here. I'm just going to ask you a few questions before we get into the actual exam. So you said you transferred from which hospital? Right, got it. Okay, great. And how long were you a patient there? 3 years. Great. And you've just moved closer to this area? Okay, got it, no problem. And I noticed you requested me. That's so awesome, I'm so happy. Which patient referred you? Natalie, she is a delight. Great, I just saw her the other day. Yeah. Okay, cool, so I've got that down. So let's just get your records up to date, because we were able to get your prior records, but since you moved, you haven't updated those with them, so we need to get all of that up to speed, okay? So can you give me the new address that you are at? Okay. Great. And what is the unit number? Okay. Got it. Okay, and the zip code? Fantastic. Okay, great. And has your phone number updated since the previous hospital? It has. Okay, can I get that number as well? Got it. That's the area code. Okay. Perfect. All right. And that was 32 at the end? Okay, perfect. And that's your cell. Good. Okay. So let's talk quickly about the medications that you're taking. We have here that you were taking something for your allergies. I think it was something like a Claritin. Were you taking a Claritin D, or were you taking just like a base? Yeah, so in certain cases, you'll actually have to go up to the pharmacy, and they allow, I think, you to buy it every 2 weeks or when your prescription runs out. So do you remember how often you were going to get that? Okay, so you didn't have to get it over the counter. Okay, so just regular Claritin, not a problem. Are you on any prescription medication at all? Okay, Zoloft, great. And how many milligrams of that? 100. No problem, great. And in the last 7 days, have you drank or smoked? Okay. And how many times? Great. Got it. All right. Good. And is there any chance that you might be pregnant right now? No. Okay. We have to ask every time. And what was the date of your last cycle? I know it can be hard to remember. Take your time. Just take some notes here. You can check. Do you have an app on your phone where you check? Great. Okay, cool. So you said that was, okay, December 3rd. great. So you just got past it. Okay, great. Let me just quickly add these notes into the computer, just so that we have everything backtracked. We like to make sure we cover all of our bases here. Okay. So how are you liking the new neighborhood? Is it pretty nice? Yeah, no, it's lovely over here, and you'll settle in no time. You'll meet some really great people. Yeah. Have you checked out the diner close by? They have excellent mozzarella sticks. I know I'm not supposed to recommend that as your doctor, but trust me. You need to try the mozzarella sticks. Great. So we've pretty much got all of this added in. Okay. Great. Alright, we'll just get that saved. Okay. Alright, let's go ahead and start with the exam. So first things first, we're going to just check your heart, make sure everything is sounding normal there, okay? Alright, so just sit upright for me if that's alright. Okay. Okay, I'm just going to move it down a little bit here. Okay. Back here. Yeah, sounds nice and healthy. Great. Alright. Let's go ahead and have your temperature checked. I know you said you were having a bit of a low-grade fever. Was that right? Okay, no problem. We will definitely figure that out. Okay, just raise your arm for me. Okay. Just give this a second. Oh, wait. Let's do that again. Take it back. Alright, so, heart sounds great. We're going to go ahead and check your temperature really quick. I know the nurse is covered, but I just like to be extra sure. Okay. Alright, go ahead and open your mouth. Don't worry, this is a sterile thermometer. Okay, go ahead, say ah. Okay, go ahead and open up and close. Give that just a second. Okay, so yeah, you've got a slight low-grade fever. It looks like you're at about 99.1. I'm not too concerned about that though. You know, there's been a bit of a virus going around, but it's not anything to stress too much about. But I am gonna go ahead and record that. What was your temperature at when you were home? About the same. About the same. Okay. Great. Okay. Alright, let's go ahead and check your blood pressure. Just gonna move right along. So I like to do this manually. I have this that I always carry along with me. Alright, so do me a favor, go ahead and extend your right arm on the table like so. I'm just gonna wrap this right around your arm here. Okay. Great. So go ahead and just put your arm through this hole. Alright, great. So go ahead and just put your arm through this hole here. Perfect. Alright, we're going to just Velcro that on. Alright. I know this is very old-fashioned of me, but it's just how I feel I get the most accurate reading. Okay. Great. Alright, so go ahead and just stay nice and calm, nice and relaxed. Don't think about anything too stressful. Alright, here we go. All right. Go ahead and relax. All right, your reading is at 120/80, perfectly healthy blood pressure. Have you ever had any issues with high or low blood pressure in the past? Your record didn't show, but I always like to ask just to make sure some things don't make it onto the record. But you haven't. Okay. Great. No history of low or high. Cool. Okay, great. All right, let me just get this put away here. You're doing great for your exam. Some people get very nervous about coming to the hospital, but I'm not sure why. I could see maybe if we were doing shots or something, but none of that here. I feel like this is the most relaxed type of yearly checkup that we could do. All right, so let's see. All right, so with the blood pressure, it is really high. I'm sorry, it is very normal. Don't let me concern you. But you've kept it very consistent. Can I ask how often you're working out? Okay, great. Awesome. And are you following a specific strength training regimen? Is it mainly cardio, low intensity, steady state? Great, okay. Great, and do you have a particularly busy job? Are you on your feet a lot at work? Or is it particularly sedentary? A little bit of both. Sure, that's no problem. Cool. Yeah, so I would say in that department to keep doing what you're doing. Your body is responding very well. Obviously, you're in great shape. Your heart sounds really healthy. Your blood pressure sounds really healthy. Now, before I put the stethoscope away, I do want to listen to your breathing. With this low-grade fever, are you having any other symptoms aside from that? Difficulty breathing, headaches, slight dizziness, anything like that? No. Okay, so when was the last time that you were sick? Oh, it's been a while then, huh? It's like you're due. We'll say 7 months ago. Okay. All right, well, let's go ahead and listen to your breathing. Just make sure that everything sounds good there, okay? We'll make it nice and fast. All right. Great, great, great. Okay, so do me a favor. Take a nice deep breath. All right, so do me a favor. Take a nice deep breath. Do it with me. Great. And I'm going to move just a little bit further down here. I'm sorry, I know it's a bit cold. All right, again, deep breath. Okay, great. I'm just going to move to the back of you here. And again, a nice deep breath. Great. And once more. Okay. Let me just check the other side here. Everything is sounding good, but just can never be too cautious. Okay. And one more time. All right. So it did sound like there was a little bit of congestion going on in your right lung, but it wasn't anything too concerning. With the low-grade fever and this very unfortunate virus going around, I would just monitor it. If anything, you could take some Dayquil if you start to get a little bit phlegmy, a little bit of an annoying cough. But other than that, it all sounded good. And you said no headaches, right? Okay, so should one come on, just go ahead and take aspirin. We have some just down at our pharmacy that you can pick up. If you want, I could write you a prescription. That way it's just ready as soon as you get there. Okay, great. All right, so let's go ahead and move on to the eye exam. So this portion is quite simple. We more so look at the overall eye health and how the eyes are moving, how the muscles are. As you know, we are not optometrists here, but we do learn a lot of the same things that they do. So I'm going to go ahead and just prepare you for that exam quickly. you just stay there. I'm going to put on some gloves. Go ahead and take these off now. Should be done with these for now. Alright. So, do you wear contacts at all or glasses? I didn't see anything there. Yeah, we don't typically write notes on that part. So you do wear glasses. Okay. Nearsighted or farsighted? Far. Okay, great. Alright. So I'm going to have you just look at me. We're just going to examine the eyes here, okay? Okay, and look up. Yeah, and let me know while I'm putting pressure on these areas if you start to feel any discomfort. Okay. Alright, you do have a little bit of redness. Is anything bothering you on this eye? No? Okay, well, you did mention the allergies, so that could be what that is. Alright, and just look over to this side for me if you can. Thank you. Okay. Great. Yeah. Alright, and look that way. Making you work. Okay. Good, good. Great. And look up for me once more. Just want to see something below here. Good. Okay. Alright, everything looks good on that eye. Let's go ahead and check out this other eye here. Go ahead and just look directly at me. I'm just going to spread the lids. Okay. Okay. Good. Alright, a little bit of redness here too, but it honestly just sort of appears that the eye's a little bit dry. Go ahead and look that way for me. And you're saying you don't typically experience any dryness or irritation? Oh, so when you're not taking the allergy, have you taken your allergy medicine today? Okay, so that could be a part of it. Alright. Right. Good. No pain or discomfort? Perfect. Alright, so I'm going to go ahead and just put some light pressure underneath your eyes. Feel for any abnormalities and irregularities, okay? Great. Alright. You can just look up or you can close your eyes, but it is better for me if you look up. I tend to look away so I can focus on what I feel. Any discomfort? No? Okay. Just a reminder, you just let me know if anything feels abnormal. Don't want to hurt you, and we also need to make sure that there's nothing strange going on under there, okay? Great. I can actually feel in your under eye trough, I can feel the sinus pressure that you have there. Yeah. It must feel nice, huh? It's releasing the sinuses. You might get a runny nose in a bit here. I'm sorry about that, but we have Kleenex readily available for you. Okay, great. So everything looks pretty good there. Let's go ahead and do a finger follow test. Okay, this is pretty simple. It's nothing out of the norm. I'm going to put my hands together like this, and I want you to tell me when you can't see them anymore. Okay? So So I'm just going to do it in a few different directions, a few different angles. I just want you to follow them, and the second you can't see them, just say out of sight. Okay. Or you can just say no. You can say whatever you want. I like to keep it as simple as possible. Okay? Alright. Let's go ahead and begin. No? Okay. No more? Great. No? Okay. Gonna move a little bit closer. No? Good. No? Okay. Great. Good. Okay. Great. It's perfect. Let's run it one more time. A little bit closer here. No. Okay, good, good. Alright. Alright. So now, let me just update these notes again here. Okay, so now we're gonna test kind of like your eye muscle and their ability to follow. Okay, so I'm just gonna do one hand, cover your left eye. We're gonna focus on the right eye. Okay, so go ahead and just cover like this, and I need your right eye to follow my finger. Okay, I'm just gonna watch as you do this. You have no prompt other than to do that. Okay, here we go. Okay, doing it with this hand. Good. Starting here. Good. And again. Okay. And again. Okay. Gonna come a little closer. Good. Perfect. I'm gonna go nice and slow this time. Good. Okay, let's go ahead and switch eyes. We can go ahead and cover your right eye, and we're gonna test the left eye here. Okay, great. Alright, are you ready? Great, here we go. Good. Perfect. We're gonna go from his side. Okay. Come a little closer. Great. Good, good, good. Okay, from the bottom up. One more time. Nice and slow. Great. Okay. Alright, yeah, eyes look great. In terms of muscular strength and ability to follow, it's been great. Alright, so I'm gonna go ahead and take these off. And I've got an eye chart here. And we're just gonna point to a few of the letters. This is not an eye exam in any way. I just want to see if your prescription is still well suited for you. Okay? Alright. Alright, let's go ahead and get started. Alright? So we'll start with the first. F, good. B, correct. E, that's good. Okay. Z, awesome. That is L, correct. Alright, let's work down the line here. Good. T, good. Can't read that one? Still no. Okay, no problem. It's not too concerning. When was the last time you had your eyes examined? 2 years. It might be time for you to go back. Although your prescription, if it did change, it hasn't changed by much. So we'll just go ahead and at least add a note to the system. We do have optometrists here. They do get pretty booked up quickly. They're one of the #1 optometry doctors in this state, so we'll get a note to at least get you booked, just because 2 years is definitely quite some time. So like I said, I'm not too concerned that you can't read that bottom line. We're typically less focused on the last 2 to 3 lines, but let's still go ahead and get that scheduled, okay? So you can have a more in-depth analysis. We could check for things like glaucoma and muscular degenerative disorder. Okay? Alright, so I'm going to go ahead and use my pen light so we could check your eyes again. Just make sure everything is flowing well there. Everything looked great when I did the eye exam, but the light is going to kind of show pupils and how they're dilating, as well as just give me a better insight into your eye health, okay? That way I could add any notes if necessary for your doctor. Optometrist doctor, I should say. Alright, so this is going to be pretty bright, yeah, but we'll make it nice and fast, okay? Okay, so it's just going to follow your eye. Okay, and I'm gonna have you kind of move your eyes in certain directions. I'll be sure to tell you. But for this first part, I need you to just look directly at me. Alright, let's go ahead and take a look. Okay. Okay. Great. Okay, and let me get some gloves back on here. So I am gonna need to touch your eyes just a little bit so that I could take a look at this dryness issue going on. Just want to make sure I'm as hygienic as possible. Okay. Kind of our job as doctors, Gotta keep everything clean. Our company got new gloves and they are a little difficult to get on the first try. Gotta get them to switch back to the latex, but anyway, alright, let's see here. So I'm gonna just open up this eye and I'm gonna need you to just look up. There we go. Okay, good. Yep, and I'm gonna do the same with the other eye. Okay. Alright, okay, so everything's looking pretty good with your eyes. The only thing that I think I would really recommend is that we just get you started on some type of eye drop or just something to really help with the redness and irritation that I'm seeing there, okay? Another thing that you can do, should you start getting some puffiness in that region, just getting some tea bags, steeping them for the allotted time, and then just letting those cool and resting those under your eyes, okay? That can help a lot with puffiness, but I know that's not really an issue, but should it come up in the future, all right? All right, so we're almost done here. I'm just going to want to do a quick mouth and throat exam. Make sure everything is good over there. All right. Let's go ahead and start with the mouth. Just going to use a tongue depressor here. We're going to get this light out again, okay? All right, so go ahead and open up your mouth for me. Say, ah. Okay, great. Okay. Yeah, so I will say your tonsils do look a little bit inflamed. Not anything I'm too concerned about with a lot of your virus symptoms. Okay. Open up you one more time. Great, thank you. Okay. Yeah, overall it looks pretty good. I'm not seeing any signs of strep or anything, and your tonsil health looks pretty good. Okay. Now open your tongue really wide, get it out really wide. Just want to check the tonsil health once more. Great. Alright, so that looks good. The last thing we're going to do is I'm just going to feel your lymph nodes and just make sure that everything is feeling really okay there. We just want to feel for any abnormalities or tenderness. Okay. Alright, so I'm going to come in and touch you here. Feel a little uncomfortable. Okay. You're feeling a little bit inflamed. Okay, nothing too concerning. It makes sense from what I just saw on the inside. Does that hurt you at all? A little tender? Not too uncomfortable though, right? Okay, good. Good. Yeah. So overall it's a little swollen, but nothing that some aspirin won't help alleviate and reduce. Alright. So if I were you, I'd definitely get home, I would pump the fluids, okay? You're definitely getting some sort of a virus. You have a low-grade fever. Unfortunately, there's not any medication that I can give you to really alleviate that. Let's go ahead and just kind of go over everything we talked about today. Some specific things that I would recommend you picking up at the pharmacy or picking up at, either our pharmacy or one closer to you, okay? Like a CVS, Rite Aid, Walgreens, something like that. Alright, so first, with your allergies, it might be helpful for you to get started on an Allegra D, like a decongestant. If you are more prone to Claritin, we can get you on Claritin D. I can write you a prescription for a 24-hour. They typically give you about a 2-week supply, okay? So I can get that written up for you. I'll get you a 30-day supply written up for your current prescriptions. That way they're ready for you. You don't have to worry about having a dry period without those. I know how difficult that can be. I do recommend picking up some eye drops for that redness. While it's not bothering you now, I wouldn't be surprised if it starts to bother you in the future. Okay, so it's just better to be prepared. Get that taken care of. Okay, just once a day, even if you're not feeling it, if you're noticing they're red, put some eye drops in there. We're going to get you some aspirin over the counter for your low-grade fever and some of this swelling here. I think that'll help quite a bit. What else was it? I'm forgetting the other thing. Optometry. You should definitely go in for your optometry appointment. Get your eyes examined since it's been so long. 2 years. I'll have the girls up front check the availability for you, okay? so I'm going to get this signed off for you. Alright, go ahead and just take that up to the front. Look, I'm really excited to be your doctor. I'm really happy that you chose me. I'm going to leave my business card with the girls. It'll have my name on there, obviously, a contact number to reach me. It is directed to my business cell phone, so it's not on me at all times. Most of the time it is. However, if there is ever an emergency, please call 911. What else can I tell you? My email's on there, so if you have any questions about your prescription or medication or anything, I can definitely help you there, okay? So that is at the front. Never ever hesitate to reach out, okay? If it's regarding your health, I'm happy to help you. And that's everything. So definitely just get home, get some rest, and we'll have all those prescriptions ready for you. I would recommend going to our pharmacy, though. It is going to be far cheaper than going to a localized chain, okay? Great. All right, well, hopefully we don't see you too soon. I want you to go home and get some rest and be healthy. That way we don't have to see you till next year, okay? All right. Thanks so much for coming in. We'll see you next time. All right. Pleasure meeting you.